Breast cancer patients in the inland Northwest now have a new tool in the fight against the potentially deadly disease. Rockwood Clinic is using a new test called MammaPrint to determine how likely cancer will return or spread. KXLY4's Andy Bishop explains how the revolutionary test works and how it changed one patient's life.
As thousands raced for a cure through downtown Spokane yesterday, Terry Nye laced up to mark a year since her diagnosis.
Your heart just drops and it's like you just feel numb.
At just 40 years old, during her first mammogram, doctors discovered a tumor in her left breast. Based on her age and tumor size, 2 doctors recommended chemotherapy right away. Dr. Renu Sinha, however, had a different plan.
We take a small sample, just a 3 cubic millimeter amount of tissue from the tumor.
It's called MammaPrint, approved by the FDA 2 years ago.
It's a test that takes the 70 genes that have been identified out of the 25,000 genes of the human genome to be implicated in tumor recurrence.
The test determines how likely Terry's cancer will come back in 5 and in 10 years.
We can more accurately predict who's going to benefit from chemotherapy, which patients are going to have much more benefit than which are not.
If you're high risk for cancer coming back, chemo may be for you. If you're low risk, like Terry, the exhausting treatment could be avoided.
We can tailor the treatment better for the patient, so it's an individualized treatment as opposed to just statistics.
With an accuracy rate of 97%, Terry passed on the chemo in exchange for a lumpectomy and radiation.
It's huge. I mean, people ask me, oh, you had breast cancer, so is that your real hair? I'm like, it's my real hair. I was fortunate that I didn't have to because I caught it early.
The Rockwood Clinic is one of 10 centers in the world participating in a trial study for MammaPrint. After a year, the results of that study will be compared to the standard guidelines for cancer treatment. Dr. Sinha hopes the test will then be available to all breast cancer patients.
Hi, Terry.
Hi.
Terry is now cancer-free.
Any problems?
Even so, she'll continue to check in with Dr. Sinha to make sure the test was right. Annie Bishop, KXLY4 HD News.